Very good morning, everyone. So from the multidisciplinary tips team of Dr. Shahreedhan and Dr. Chung, we now move on to another multidisciplinary team. And I'm very happy and proud to introduce Prof. Julia and Dr. Chung Jin Ian. Dr. Chung Jin Ian will start first. Dr. Ian is a family medicine specialist from Department of Primary Care Medicine. And he will give an introduction to diving and also diving medicine. And this will be followed by Professor Julia, who will give a special feature on adaptive diving and share our experience in UMMC, incorporating diving for people with disabilities as part of our recreational rehabilitation program. So over to you, Dr. Ian and Prof. Julia. The topic today is fitness to dive, health beneath the surface.
Thank you for the introduction, Prof. Nazira. Thanks for having us, the audience, and thank you for taking the time off duty to watch this. I'm Ian, family medicine specialist from RUCA, also a certified medical examiner for divers, certified by the Asian Hyperbaric and Diving Medical Association. Today, I'll be sharing a bit about how diving affects health and how health affects diving. Okay, so a bit of an outline, give you a bit of introduction of diving medicine, then DCS, let's talk a bit about that. Perhaps maybe some of you in the audience may already know decompression sickness, then just touch a bit on physics and physiology, what are the fatalities and injuries that we know, and finally to what is fitness to dive, and also some case illustrations before the story from Prof. Julia. Okay, initially, first of all, any divers in the audience right now? And I know it's a bit hard to respond, but I'm sure there are a few of you all in the audience since it's such a well-known sport. But does anyone not know what is diving? Or in this case, scuba diving. So for the purpose of this talk and for the benefit for benefit of those who do not know, scuba actually is an acronym which stands for self-contained underwater breathing apparatus. In diving medicine, though, there's another lesser-known activity called breath hold diving or free diving. Yeah, it's self-explanatory. Now, diving is fun. It's intense, yet it's relaxing at the same time. It's like hiking, but in an aquarium. And if you are good enough, it's like hiking in zero gravity, as you can see in the top video here, just hanging in the column of water. Yeah. In fact, it's such a passion for some people that they would head over to Port Dickson, a place not known for its diving, to explore. And yes, bottom left video, that's us in PD, in green water. There is still life there. Okay, yet fun activities like this require certification, or what we call license. Why do you think is that? Because it can be dangerous, and that's what I like to share in a while. But first, a bit of trivia about recreational scuba diving. So scuba began in about 1940s by the invention of the aqualung, by two Frenchmen, Jacques Cousteau and Emile Gagnan. Then after that, agencies started creating training modules for the layperson to use the gear, and then it started popularizing since 1950s till now. And today, Malaysia contributes to a large proportion of certified divers. About 15% of all certifications worldwide. So we have the top three, US, Thailand, and Malaysia. We are among the top three. And this is from PADI, if maybe you have heard of it before, the largest agency for recreational diving. And they claim to have certified over 1 million divers annually. So this highlights the volume of recreational divers we have in our region. But the dangers of hyperbaric environment or the diving environment, specifically the compressed air breathing environment, was already apparent in the 1800s. So on the right here, as you can see, this is a caisson. So in the past, they used this for mining coal and all. So imagine basically a container flipped upside down. They put it on the soil. People are working down there, dig, and the container sort of just goes down. So upon reaching a certain depth, water starts pouring in because groundwater again. So in order to make sure that the environment can still it's still fit to work, they had to push the water out. So what they do is they use compressed air from outside. So they have to seal up the chamber, compress air, push the water out so that they can continue digging. So they didn't know that decompression sickness can happen at time. Miners and caisson workers develop mysterious pains, blindness, and sometimes even death after coming out of work. And those who were still alive mysteriously became better upon returning to work. So it was not until this field gentleman here discovered the correlation between nitrogen and bubbles. And we have Paul Bert here, from another Frenchman who found that early on in the 1800s. And then we have here Haldane, who is widely known as the father of modern decompression theory. So he's the one who scientifically measured at what depth that these symptoms start to occur, tested it on animals. And his work forms the basis of the dive tables that we use today. So for the physics aficionados and for the NS, this is probably everyday work for you all, but these few are the common laws that govern most of the things that are happening in the hyperbaric environment. So we have the Boyle's law and Henry's law. Maybe in the interest of time, anyone interested can look into it. So what happens to our bodies when we actually go diving? First of all, most importantly, the cardiovascular system. So what happens is when you are immersed, there is increase in preload and afterload. How does that happen? So when you're immersed, peripheral vasoconstriction happens, blood starts pooling centrally, that will increase the preload. Also, when it's all vasoconstricted, afterload is also increased due to the resistance. And from the videos that you saw, our position is always horizontal. So gravitational pooling doesn't work there anymore. So venous return increases, also increasing preload. So from there, you can tell that the heart has to work a lot harder when you're underwater. Then next is the respiratory system. How does it change? Gas density increases underwater. So you're actually breathing harder because of the change in the gas density and ambient pressure. And when that happens, CO2 retention goes up. And when it's bad enough, it can cause problems. And the neurological system, similar to Antonox, the gas we use as an analgesic during labor again. Yeah, so high partial pressures of nitrogen can actually cause a bit of a narcotic effect at a certain depth, but easily reversible. And then lastly, other systems. We know that we have a lot of rigid air spaces within our body, most notably around our cranium. So these sinuses cannot expand, cannot contract. And in changes in pressure, if you cannot equalize the pressure, it can cause ruptures inside. So these are the few changes that are notable to happen when you are underwater. Okay, now that we have an idea of how diving causes some changes to our body, let's look at the statistics and fatalities, commonly reported injuries over the years. So from 2007 and to 2018, right, you can see the fatalities here. It changed from the top one, drowning, and then over the years, it became cardiac events. So this actually underscores the fact that we are having an aging diving population, not only aging general population, but the divers are also aging as well. So, and it is accepted here because we know that data collection for this one is quite iffy. It relies on voluntary reporting. So I think it's grossly underreported. So it's very difficult to judge what is the actual numbers. And the numbers here are quite small. So just a bit of underreporting can actually skew the data a bit. But it is accepted by experts that cardiac events would account for about 1/3 of most of the cases, whereas the other three is almost equally divided between drowning, arterial gas embolism, and immersion pulmonary edema. So what is arterial gas embolism? Very quickly, basically when a gas bubble is big enough to enter the arterial system, and then when it enters the brain, and it causes cerebral arterial gas embolism. So how can a bubble reach that size? Usually it happens when there's pulmonary barotrauma. Lungs pecah, air gets pushed into the arterial system, and then it travels over the body. Whereas immersion pulmonary edema is basically increased preload, afterload, heart fail, so water gets masuk into your lungs. Okay, then other interesting statistics. We can see that, of course, we know males account for the vast majority of cases. Asia, we contribute about 10% due to the vast majority of divers in the western side. And although we think that commercial diving, those welders underwater at the oil rigs and all that, we thought they would have more cases, but apparently recreational diving is still the most common cause of death because of the sheer numbers of us here. So all we've looked at are the severe cases only lah. But don't forget that there are other hazards that you can see when you are diving. And I've been told that this may put off people from picking up diving, talk about hazards and all, right? But I hope the photos that I place here remind you of the reason why I continue to dive. And it is an informed choice. To be honest, it's still considered a very safe spot as long as we are aware. So now, moving on, who can dive? This I'll share a bit about the principles of fitness to dive. So the working definition is basically an individual fit to perform his or her tasks effectively without the risk to self or others, punya health and safety. And when you put it in a working environment, the others will extend to colleagues, third parties, and also company assets. And we judge fitness to dive based on these 4 principles lah. So very simply, let's say can my asthma compromise me or my buddy's safety? Or can insulin compromise my safety? Will diving make my CSOM, my chronic suppurative otitis media, which means you have a perforation in the tympanic membrane, will it make it worse? Will diving make this condition worse? Will my COPD predispose me to having a diving illness, which is your decompression sickness or your AGE? Or will beta blockers affect my ability to perform work? So if there's any yes to all of this, then most likely you are not fit to work. But for recreational diving, it will be a different story lah. I will share a bit later. So, but before that, first we need to know who regulates fitness to diving. So are there any rules that governs who penalizes or who legislates this lah? So as we can see here, there are no regulations for recreational diving. So by right, those who are planning to take up scuba diving, there's a medical declaration form that you have to fill up. So if you fill up, then usually the dive coach, the instructor will ask you to get yourself checked lah. And there is no requirements actually for what qualification the doctor needs to be, because there are no regulations. So, but I believe none of us are usually confident enough to sign off unless you have some background in diving medicine. So that's where I come in. Okay, but for commercial diving, this of course is different lah. So there is the Jabatan Laut as well as the DOSH, and then you have all the acts that jaga this one. That's why you can see that the safety standards are a bit different. Okay. Okay, moving on. Let me illustrate with a case. So can a person with diabetes mellitus dive? So the answer is it depends. Let's see here, a 49-year-old female planning to take up scuba diving, the open water certification. She declared to have diabetes. Very honest of her. That doesn't happen many times on a pre-course screening. So the instructor asked her to go get certified first, get a clear from the doctors lah. So her history is she has diabetes, relatively diagnosed a bit late, about 44, 45 years old. She's already on 2 OHAs, no complications, vital signs are okay, slight obese. HbA1c suboptimal, but fasting, as you can see here, is quite okay. Postprandial, borderline tinggi, it fluctuates lah, and no complications. But she had an episode of hypo, although it's quite rare and it is provoked lah. So this case, what do you think? Can dive or not? And to make things easier for the fitness assessors, there are actually some targets lah. Basically, these are still considered arbitrary because this whole realm of diving medicine is not very, there are not a lot of studies done in it lah. But basically, we should know that the patient with diabetes should be well controlled, no hypoglycemia, no risk of hypoglycemia, BMI ideally less than 30, no target organ damage, and she should have good self-management knowledge lah. Okay, so in this conclusion, she is, for me, conditionally unfit for recreational diving, but we can reassess again. Last time in the past, maybe 20, 30 years ago, type 2 diabetes is considered a contraindication to diving. But nowadays, for recreational diving, we can reconsider as long as you can mitigate all of these risks, hypoglycemia. So what we can do is maybe change her glycoside to something that is not so hypoglycemic, achieve a HbA1c target, then make sure that she controls well, and then demonstrate the stability of her glycemic control, and also make sure that we educate her on self-management. Then once we reassess everything fulfilled, perhaps we can give her the go for diving. Now I have another case, but I think it'll take too long. So I think I will tease you all with this. What about a person like this, 28-year-old male, lost his left leg to necrotizing fasciitis? Do you think he can dive? So, as we have seen here, fitness to dive means that we can perform the activity safely without jeopardizing health and safety. In commercial diving, the tasks are demanding and the tasks are set. So your fitness needs to be right up there to balance out the demands of the diving. You're handling heavy machinery, heavy equipment while in heavy suits, while being in very harsh conditions. So definitely strict criteria must be enforced. But in recreational diving, the task is assumed to be diving to the limits. But in recreational diving, you can actually control the tasks that you're doing. So in this case, as long as if the task is achievable with assistance, why not? So from here on, I'd like to introduce Prof. Julia Patrick Inkasan, consultant rehab physician, also a member of an organization that facilitates such dives. Please welcome Prof. Julia.
All right, thanks, Ian. So I'll share my slide. Okay, let me see. All right, so now, can you see my slides? Can, right? Right, okay, so let's go. Mine is a lot of pictures and video, no text. Ian is already heavy on text, so right, come. So this is my first diving experience, my first trip for adaptive diving, right? Tioman 2018, but PPM has been doing diving, adaptive diving since 2016, it's not mistaken, but my first experience is in 2018. This is in Pulau Tioman. These are my heroes. These are all patients with spinal cord injury. Result is the first one is a person with tetraplegia, meaning that limited function of the upper limb. Rizal and Basri both paraplegia, and all of them have complete loss of function of their lower limb, meaning cannot stand, totally dependent on wheelchair. So these are the first three people who died, whom I have first-hand experience doing adaptive diving. All right, so fitness to dive, who can dive? Right, the ability to dive in people with disability is defined by their uncontrolled medical condition and not by their disability. Definitely not by their physical disability, have leg, no leg, have arms, no arm. That does not mean they are not safe to dive, right? Okay, compared to what Dr. Ian has said, for people with disability, right, the diving, the way they dive is a bit, the diving program is a bit different. First of all, in recreational diving, one dive master, 5 or 6 divers, right? In people with PWD, minimum 2 divers were trained in adaptive diving for one PWD, or sometimes we can have 3 or 4, like Rizal might need 4 because he's a tetraplegia. So one PWD diver with 4 people supporting you. So that's one difference. Number 2, the aim for us, right, is to get that open water certification, right? What for, if you don't get it. But the aim for people with disability might not be that. That means to get open water certification, you have to meet certain criteria, certain depth. But for them, it is not it is good if you can, but it is not the aim. You can still enjoy scuba diving, even though you don't have open water certification, right? Because there are 4 different reasons for rehab, right? And a lot of, let's say dive hard, right? The rehabilitation benefit of scuba diving is done in deep pool, not in open water, right? So those are the differences between adaptive diving as well compared to recreation diving in people with PWD. So we are a bit lax actually, and we have a lot of pool trial session, 8, 10, before we are confident enough to bring them to open water. Some might not pass, right? Some will just stay in the pool and not go to open water. So scuba diving for PWD to reap the benefit may or may not be in open water, right? Hearing impairment, is done already. So as well, you have somebody who can teach them using sign language, they're good. Blind, yes, can. Why? They can feel. I think Prof. Nazi has the first-hand experience. What can you see? I'm blind. But they can feel the fishes, they can feel the water. As long as you know the way how to communicate with them underwater, then it's fine. Because you always need to ask them, are you okay? Are you okay? Right? So you have to find a way how to communicate. People with cognitive impairment, right? For divers out there, you know that you have to learn how to use the regulator. Make sure you don't try to breathe your nose. I don't have that panic attack. And you have tasking, moving your arm, moving your leg, and at the same time try to communicate. So a lot of tasks are being involved. Can a person with cognitive impairment do scuba diving? Answer is yes. Okay. So this is the conventional one where you have to learn how to use the regulator, the mask, have to not have panic attack and communicate. And what about, and we do in pool trial, right? We always see whether they can perform all these things. Let's say they can't. The option of full face mask is there. So in full face mask, you breathe normally. It's a full face. I've seen one because we have a diver who are nonverbal autistic. So he used that to dive. So he can dive, right? And you have to customize their diving activity, just like how diabetes can eat, but you must customize their diet. So the same thing with people with the PWD. So we are a bit lax because we are not chasing the certain criteria to achieve the open water diving. Right. So why do I continue on supporting adaptive diving for the past 7 years? Why do we, in fact, me, Prof. Nazi, and my team, continue supporting? First is benefit to the person itself. So this is so highly shared. This is congenital deformity, no lower limb, and she's a certified open water diver. Right? So this is Basri. Ask Basri, apa you rasa? Basri said, I can stand. This is the first time I stand without an equipment underwater. And he told me, on land, you can walk. I cannot walk. In the water, both of us cannot walk. So there is, that kind of feeling for them, right? This is Riza Faisal. This is probably in Sipadan, right? The freedom. Oh, they always say the freedom to move, right? And then we first of all, when the first time I'm always scared of whether the pain or the spasticity get worsened, because when you go underwater it's cold, but it is not. In fact, it relieves it. I think it's because that they are continuously enveloped in water in forces that seems to be whole body therapy, but unfortunately it doesn't last long. The most is 1 or 2 days. The second reason why is that community awareness. Who would expect this place to be visited by people on a wheelchair? The presence of wheelchair in a place like this probably remind people that, people with disability also wants to join all the activities that we do. Right? So I'm quickly just... So this is community awareness. A lot of people who are here are actually people from the area, from the jetty. So we teach them, we make them aware that this wheelchair, people in wheelchair also want to use their facilities, teach them how to carry the wheelchair. A lot of them want to carry the wheel. If you carry the wheel, if you salah carry, the wheel can come off. The same with this. Right? So these are community awareness. Also, awareness to the divers. I think more and more, we need more people trained in adaptive diving because, like I said, one person might need 4 adaptive buddies, right? So we are exposing more divers to adaptive diving. and also to us for the medical community, especially for rehab. So we learn as we go. For the past 7 years, we started with 0 divers in our department. Now we have, of course, we have people from primary care joining us, right? We have around 15 to 18 divers, and 3 of them are trained for additive diving, and I think 4 is in the making, right? And we also have a group of staff who are giving on-land support. So we have on-land support, we have underwater support, right? And yeah, so there are more of us that we are growing. And the thing that we have to do, some of them, we have a program just for female divers, and somebody is the first time on flight, so we have to accompany them, right? But they are very nervous. They have never been on a flight before, right? Okay, so this is the thing that we do to support them, right? Not all things are accessible. This is a bus trip to Johor, I think. And this is what we are given. We have to learn how to finish. So literally have to carry them up the stairs, right? And to make sure it's done properly, protect yourself and protect the patient. Be innovative, do something that maintain the independence. It's not easy to push a wheelchair in the sand. In fact, we don't advise them to push. Normally, we help them to push, but you can do things like this, right? I'm going fast because of the time. If there's no plywood, it's very difficult for her because definitely the crutches will sink in the sand. And that we learn to be innovative. This is a heart attack for me, actually. This is in Tioman. This point of time, none of us have any experience. So it is really depending on the guy, the board guy, that's Jim Elliott, the founder of DIFAD. And transferring between boat and jetty is very scary because you cannot control the sea. You cannot control the wave. And this is for us, this is the easiest lah. But then the divers are carrying their tank and carrying the patient as well. Right? Because sometimes we can dive from the shore. This is what we do. And yes, complicate. All the happy story, they're so, I don't think it's sad, but there is fracture story as well. I have 2 experience. One is Riza came 2 weeks after a dive and said, "Oh, Prof, still swelling, huh?" Yes, sir, what happened? Oh, cellulitis. Treated for cellulitis. Still swelling. Then when I touched, I said, must be fracture unless proven otherwise. And it's a fracture. We have malunion fracture. But nothing much can be done because he doesn't have pain, right? He doesn't have pain. So the other guy is in Bidong. This is a fresh case. And said, Prof, can see or not? One of the patient that swelling of the leg or the feet. And then I went and see and said, this is fracture unless proven otherwise. And you know, in islands, not easy to go to the mainland. There's no hospital. This is in Bidong. And luckily, it was the day when the king visited and the king medical team helped him, you know, go to the mainland. So there are fractures. This was my worry at first. Our patient do not have bladder control. Some of them on CBD, right? What do we do? No CBD, no continuous drainage, because if you have continuous drainage, it get compressed in the water, the urine flows back to the bladder. So that is a no for us. Take it out. If it's a free flow, let it free flow, right? Nothing wrong with that. But if you have if the patient have retention needs to do is on CIC, well, you do the CIC on the boat. Right, so our patient does their CIC on the boat. If the trip is a bit too long and you know that diving is very tiring, they will drink a lot of water, right? And okay, since last year, we started our program with children. We have 2 batches. The first batch, actually, we took those who are without physical impairment, disability, so Down syndrome, autism. So we have that first batch, and we was a bit worried about how do we teach them? You know, attention span is so short. Well, yeah. So, and that also, and the second batch are those with some form of physical disability. So we have a lot of cerebral palsy, hemiplegic, diplegic, who are in the second batch. And one of them who has upper limb amputation is a certified diver already. Another 4 are going for the open water somewhere this year, right? So children, and this is just their testimony, and these are our partners. Thank you very much.
Thank you very much, Prof. Julia. That was excellent. And Ian, very excellent presentation. I'm looking at whether there's any questions here from the
I see one.
audience.
There's one from Dr. Jazlan.
Okay. Can't see here from Dr. Jazlan. Maybe I'm looking at a different. Oh, yes, sorry.
The Q&A.
Okay. So, Dr. Jazlan, Dr. Ian, any resource or guidelines we can refer to decide the fitness to dive?
Okay, so when we go through the fitness to dive certification, we are given a few resources, but ultimately the judgment comes back to us because of most of the recommendations are still expert opinions lah. But anyway, thanks for asking. This is usually can't see this one. Alamak. We have a book that alamak tak nampak lah. But we have a book that is sort of like given to those I mean, you can purchase it lah, basically. So there is a, yes, Prof, that's the one.
This one?
Yes.
I've got it.
Yeah, so we use that as a sort of a reference for us, but ultimately, recreational diving is a bit difficult to decide because basically anyone can dive. They don't come to us also, they can just, just cheat in their declaration and then they just dive. Yeah, they take their own risk lah. But this is more clear cut for working divers lah. So I think this is more relevant for working divers actually.
All right. So
thanks, Dr. Ian. Prof. Azrianti asked here, how can we be involved in the activities and certify as adaptive? Thank you very much for asking that, Prof. Yanti. Actually, I'm beaming like a proud mother because, I'm as one of the founding members of the diving communities or adaptive diving communities in rehab in UMMC. I can say that the program has grown so much, as what Prof. Julia said. There are many of us who are certified divers and who are volunteers, and a few of us are also adaptive diver. I'm adaptive diver as well, and we've got a few who are training to be adaptive divers. So yes, we are looking for volunteers. So please get in touch with Prof. Julia. We've got a registry for volunteers in PPUM. And also people often ask me about what specialties you have in the hospital. Say we have almost all specialties except for diving medicine and aviation medicine. But for diving medicine, I'm happy also that that Ian today has presented an introduction to diving medicine, as this is something that we are able to offer with Ian and myself being certified diving medicine specialists. The next one is Prof. Saja, how to deal with fear of water and big fishes. Prof. Julia or Dr. Ian, who would you like to take that?
all right. I don't know. I mean, looking into, we do have people who are scared, and problem is that when you scared, you see big fishes, you might lose the ability to control your breathing and your regulator. So that's dangerous. So of course, if snorkeling first, or you wear that full mask lah, like the astronaut. So at least you hyperventilate, you can hyperventilate inside the mask. Right, but it's about sensitization. I think lah. I think, yeah.
Stuju. Yes.
Yeah.
Yeah, I agree. So basically, usually it's always water comfort first. If you're not even comfortable in the water, then it's a bit difficult doing an activity that involves being in the water. But yes, it can be desensitized, and that's what they do for the divers, PWD divers, right? Yeah.
Yeah, I guess that's why we start, with the training in the pool, because address the pure water first. Yeah, and big fishes. I don't know, Prof. Saja. I think once you're in the water, you'll be very happy to see fishes, and you want to see lots and lots of fishes.
Setuju.
Any more questions? So I think we can wrap up today, but I think I'd like to conclude by saying that diving is safe, but you must be honest when doing the medical declaration. And for those to be who wants to be certified, there are many bodies out there that you can certify with. The most common one is a PADI certification. And for commercial diving, there's also diving medicine specialty that you can look into so that you'll be able to certify commercial divers. And Prof. Julia, scuba diving for people with disabilities, I think it shows that scuba diving is an inclusive sport, can be an inclusive sport for people with disabilities. For them, it's freedom from impairment underwater, and that it is a very good out of wheelchair sport. And I guess not anything is without risk. There are risks involved. Not anything is without complications, as highlighted by Prof. Julia. But awareness and also knowing what you are going into is very, very important. So with that, I think we can wrap it up today. Thank you very much, everyone.